So welcome everybody to this webinar where we're going to talk about Kratom or Kratom or Kratom. I've heard it pronounced a lot of different ways. I'm Greg Skipper. I'm the medical director of the Center for Professional Recovery in Malibu, California. And let me see if I can get the slides working here. Oh, there we go. So just a case presentation briefly. We had a 37-year-old anesthesiologist. He was in residential treatment for opioid use disorder. He went on a therapeutic leave home to another state, happened to be Oregon, by the way. We have some Oregon people here, during his third month of treatment. And when he came back, he did not know that we were routinely testing for Kratom. And so he was positive for the metabolite 7-hydroxymetragenine. And when we questioned him, he said, yeah, he used Kratom. He didn't think it would be detected. And he had purchased it at a store prior to admission. He had taken that to try to help him deal with his fentanyl detox before he came in. And he had some left over, so he took it when he was home. He said that Kratom is legal and not addictive. But he did admit that the effect of it was very similar to fentanyl when he took it when he went home. So I just wanted to talk briefly about our U.S. history of incompetent and irresponsible opioid policies. So it seems like over the last 100+ years, there's been numerous new drugs that have been introduced as non-addictive pain meds, later to be found addictive, including, notoriously, heroin in 1898, oxycodone, 1916, meperidine was introduced as non-addictive in 1938, propoxyphene, 1957, tramadol, 1963. So, you know, drug companies are constantly seeking, and doctors and patients want, a non-addictive opioid. Wouldn't it be nice? So, are there any non-addictive opioids? None that I know of. When are we going to learn that anything that stimulates mu receptors is going to be addictive? So, all those non-addictive opioids I just went through, you know, had their turn of harming people, causing addictions, you know, death, etc., before they were finally controlled. So the newest one of those that was finally controlled is tramadol. And I was involved with this quite intensely. You know, tramadol was patented in 1963. It was approved by the FDA in the United States in 1996. It was used prior to that in Europe for a couple decades. But anyway, it was licensed by Johnson & Johnson under the name Ultram. It was heavily sampled to doctors, and it was advertised as a non-opioid analgesic, which is pretty amazing since research had shown that it stimulates the mu-opioid receptors. And when I looked into this, you know, the FDA did a study where they gave people IV tramadol and showed that it didn't have a morphine-like effect. Well, it turns out that IV tramadol doesn't have much effect, and this is relevant to Kratom, but it doesn't have much effect because the potent compound for tramadol is its M1 metabolite. So it has to be metabolized. So when you give it IV, you don't get much effect. But if you take it orally, it goes to the liver, it's metabolized. And the M1 metabolite is a morphine-like drug. So anyway, the FDA erroneously classified it as non-opioid, allowed the drug company to do that. It was heavily marketed. And it wasn't until, well, it was a few years later that enough cases of addiction had popped up and overdoses that they made the drug company add the black box warning. And I just think this is hilarious. Tramadol may be habit forming, but only in patients prone to addiction. No drug probably is going to cause addiction except in patients prone to addiction. But anyway, that was what they had them put on the package insert. And again, we're talking about tramadol for a moment because I think it's relevant. So a lot of reports were coming in of seizures from high doses and addiction. I saw a lot of those. Numerous states started looking at controlling it since the feds didn't, and that's going to be relevant to Kratom as well. By 2014, tramadol was one of the most commonly prescribed medications in the United States, with over 24 million prescriptions per year. And I might add that tramadol took off in the world. I was in Cairo, Egypt, 10 years or so ago, and it was the biggest problem there. And I'll mention that again in a minute. So finally, tramadol was scheduled as a class 4 narcotic by our FDA and DEA in August 2014. And I already mentioned this, but in the Middle East, it was heavily abused. And this is also kind of relevant to Kratom. There's a statement in the literature that tramadol was thought to be a major factor in the success of the Boko Haram terrorist organization. So one former member said, whenever we took tramadol, nothing mattered to us anymore except what we were sent to do, because it made us high, and very bold. It is impossible to go on a mission without taking it. So that's going to be a little relevant to Kratom as well. So I published a letter to the editor along with a couple colleagues from Michigan and from the FDA about tramadol abuse in the physicians. This was in 2004, where we found that tramadol was actually the third most common drug abused by physicians in our survey of charts. So it was becoming heavily abused. So it kind of just snuck in there and started being abused by doctors. Okay, let's go to Kratom. So it's the latest safe opioid, in parentheses. It comes from this tree, which in Thai is called korth. I don't know how they pronounce it, but that's what the writing, so it's Mitragna speciosa. It occurs in Thailand, Asia, Africa, and tropical areas. It grows in the jungle, and it can grow as high as 100 feet. That's the tree, and in the picture there. So how do you take it? Well, either crushed leaves, chewed. You can just chew the leaves. Powder made from the leaves. Capsules, tablets, liquid, gum, or resin. I think you can even smoke it. Somebody mentioned it sold in smoke shops, but I think maybe they sell pills. I'm not sure. But most commonly, it's either drunk as a tea or the capsules are taken. It does say smoke, so you can smoke it. I forgot. Okay, so there's a picture of some of the leaves ground up, the tablets in the tea, and there's tablets in the ground up leaves. So it's just interesting that in Thailand, in 1942, when they made opium illegal, the use of kratom went up rapidly. So the next year, in 1943, they actually, in Thailand, made the trees illegal. So there's no new planting of trees, the korth trees, and they ordered all the korth trees cut down. But there was no way to enforce that in the jungle. There's so many of these, apparently, that people that live out in the boonies and in southern Thailand, they had plenty of access. In 2019, when they legalized cannabis in Thailand, they also decided to legalize kratom, but only with a prescription, which is interesting. And they did in 2019 in that law that legalized it, they made possession of more than 10 kilos of kratom, a crime punishable by a significant prison term. So how available is it? Well, the kratom, there is a thing called the American Kratom Association, and they suggest that they think over 5 million people in America are using Kratom. Between those dates, February 2014 and July 2016, the Narcotics Control Board authorities in the US encountered 55 tons of Kratom, equating to 50 million doses. In Thailand, by the way, in 2008, even when it was illegal, in southern Thailand, they found that 70% of men were using Kratom, and they use it to help them work. They feel like it gives them energy and helps distract them from the grueling things that they do to work. So it's used like that, similar to how tramadol was used by the Boko Haram. This is a picture from Oregon. Here's a, I don't know, it's Chester's, they sell chicken. This is like a mini mart, and the sign outside, Kratom sold here. And actually, when I was in Oregon a year ago, I saw quite a few Kratom sold here signs, mostly at head shops, but here and there. And I've been told at smoke shops they have it widely. So it's available, and you can buy it over the internet. It's a legal drug, generally speaking, in the United States. So this American Kratom Association advocates for the safe use and further study of Kratom. This is on their website. They say that Kratom is an alternative to coffee to help mood and focus. Again, on this association website, they say Kratom is not a drug, not an opiate, and not a synthetic substance. It is a safe herbal supplement, they contend. They say that, and I'll mention this again in a minute, but they say that the FDA has deployed an unrelenting anti-Kratom disinformation campaign since 2012. And on their website, they have testimonials of several ex-combat veterans who use Kratom for pain management, saying that it's very effective and lobbying, for it to remain legal. So what are the active ingredients? You guys know it's mitragynine and 7-hydroxymitragynine. And like tramadol, interestingly, the 7-hydroxymitragynine is the potent opioid. So the mu receptors are stimulated, as well as probably kappa and some maybe norepi receptors. It's not clearly worked out, but on the mu receptors, the mu-opioid receptors, 7-hydroxymitragynine, the metabolite, has 9 times higher affinity than the parent drug. And it's been reported that, which, leads you to believe that the opioid receptor is the primary focus here. But in overdoses, overdoses have been reversed by giving naloxone in emergency literature. So this is a concern, is like how much mitragynine and subsequently the potent metabolite, 7-hydroxymitragynine, how much is in these leaves? Well, it's very unpredictable. One study cited here, they looked at 8 samples purchased from head shops in West Chicago, and they found levels of mitragynine varied hugely from 3.9 milligrams per gram to 62 milligrams per gram. So that's, almost 20-fold difference. There's also been concern about this Kratom sold like this herbally of containing bacteria, fungi, and even salmonella. In their study, they found 6 samples contained bacteria and fungi, but none contained salmonella in their small study. But 7 out of the 8 contain nickel, lead, and chromium. So there's a concern there about this natural herbal product containing, particularly, I think, toxic here would be the lead and the chromium. There is a risk of overdose. There have been overdose deaths, usually in combination with other drugs, which is common with any drug. It's oftentimes when people overdose, they are on more than one drug. So it's not clear totally, whether these overdoses, which I'll mention again in a minute, are solely due to Kratom. But Kratom can cause hallucinations, chills, vomiting, liver damage. I'll mention some other adverse effects in a minute. So the advocates of Kratom on this association website and other places, they hope that it will be good as a self-treatment for opiate addiction. And we hear people doing that. They hope that it will be good for pain management. Maybe it will. And again, in Thailand, a lot of people take it to help them get through their workday. Kind of like in Bolivia, people chew cocaine leaves, so, or we drink coffee. So that's the comparison kind of. Anyway, there are a lot of adverse effects, nausea, vomiting, chills, sweat, all these things, loss of appetite, delusions. There have been psychotic breaks after taking Kratom. One study looked at how much liver damage has been done, and there's quite a few case reports in the abstracts and literature, 7 cases from this network, 25 in the FDA database, and so forth. So, there's some pretty good evidence that in some people, Kratom can cause liver damage. There have been DUI arrests where they only found Kratom on board when they felt that the person was driving impaired. So it causes impairment. There is a withdrawal syndrome. If you're taking Kratom for long enough and a high enough dose, you get an opiate-like withdrawal syndrome. And again, there have been deaths. So what about legality in the USA? So it's outright illegal now. The states have taken action. In these states, Rhode Island, Vermont, Indiana, Alabama, Arkansas, and Wisconsin. And in some local areas, a lot of local areas, like San Diego's made it illegal, Sarasota County, Florida, Jerseyville, Illinois, Union County, Mississippi, and others. So, people are concerned and laws are being formed, but not nationally at this point. And I'll get to that again in a sec. The Kratom Association has promoted this thing called the Kratom Consumer Protection Act. So they say they want to make it safe. And so they've helped some states pass laws, like in Oregon. Now you're supposed to be able to only buy Kratom if you're over 21. And they require that any product that contains Kratom, it needs to be disclosed, because there have been cases where Kratom is in things, other supplements or whatever, and not disclosed. So the states Arizona, Nevada, Utah, and Georgia have enacted laws that supposedly make it safer, but have not prohibited it. Around the world, interestingly, we have Dr. Helander on the line here. He's from Sweden, and he says it's legal in Sweden. So, but it is illegal in Australia, Denmark, Finland, Israel, Japan, all these places. I won't read them all. Interestingly, it says here it's illegal in Thailand. It's still, illegal except for by prescription in Thailand. So that's a recent change, and nobody knows its status in China, actually. It was placed on the anti-doping, the World Anti-Doping Agency that does the testing for the sports, and there's been one report of an athlete disqualified from a pre-Olympic event because of Kratom. Okay, this is an interesting thing. In 2012 is when Kratom first appeared, and by 2016, because of a lot of reports of problems, the DEA announced it was going to reclassify Kratom as a Schedule 1, which is prohibited. But there was a huge public response. So that does support the idea that there are a lot of people taking it. And they did demonstrations. This Kratom Association led some of those. Petitions, calls for Congress to overrule this classification. And there were demonstrations. They got over 100,000 signatures for the White House, and they were saying that Kratom does no harm and it's useful in managing pain, etc. They maintain that it's safer than prescribed opioids. There are few deaths and many testimonials about the people liking it. So these two representatives from the House of Representatives from Wisconsin and Arizona got 50 signatures of other congressmen. They called the DEA's decision to ban it hasty, and they said it would have serious effects on consumer access, of course, and innovation in treating addiction. So anyway, the DEA, in an unprecedented move shortly after they prohibited it, they withdrew the notice of emergency scheduling. And so it remains legal and uncontrolled nationally in the United States. So it's uncontrolled. It's sold widely, as I said. It's marketed as a non-addictive wonder drug. In June of 2019, the FDA issued warning letters to two of the largest Kratom marketers listed here in California and North Carolina for illegally selling Kratom with unproven claims. So some of the claims are things like, it treats opioid addiction, treats pain, anxiety, cancer. They said it was these companies that the FDA was concerned about. They quoted some of the company ads saying that Kratom is a natural alternative to treat depression, anxiety, addiction, diabetes, maybe because it decreases appetite, chronic pain, and fatigue. And they say that it takes the place of dangerous drugs like hydrocodone and oxycodone, and it can help people wean off these drugs and off heroin. Some have claimed that Kratom can protect you from cancer. Kratom is used for energy, to increase attention and focus, to relax, and also to treat pain and addiction. Many customers have used Kratom to treat chronic pain, migraines, opiate addiction, ADHD, anxiety, depression, arthritis, insomnia, and much more. Now, all these claims, despite the fact there's actually been no study that I could find in humans that actually looked at whether there were benefits. There have been quite a few reports, and this is calls to poison control centers over a 6-year period from 2011 to 2017. And there were 1,807 reports, and most of them were in 2016 to 2017. So the use of it is increasing, and it's continued to increase, I believe. Okay, so this is another crazy statement. The one below is one reminiscent of tramadol. It says, tramadol can be addictive in people. That's the tramadol statement. The one for Kratom is many people use Kratom to overcome opiate addiction. However, people using Kratom to overcome a pre-existing opiate addiction may need to use Kratom daily to avoid opiate withdrawal. So that's kind of weird, right? So, that makes it look like it's another opiate that you would then continue to be addicted to. And finally, there is lab testing now for Kratom in the United States. In a lot of labs, they do urine testing. I know of at least one lab that does hair testing, a US drug test lab. And there's a report in the literature about an ELISA quick test that's been developed, but as far as I can tell, it's not being commercially used yet. So my recommendation, and then we'll open it up for comments and questions. My recommendation is to add Kratom to your list of prohibited substances in your monitoring agreements for health professionals, and to do some Kratom testing, either routinely or when it's suspected, particularly in opiate addicts, but it's pretty widely used now. So maybe it needs to be tested a lot more often, and maybe even added to some standard panels. And if you know of any adverse events actually from Kratom, it's a good idea to report it to the FDA's MedWatch adverse event reporting program, which you can just Google to find how to report that. There's a form online. Okay, kind of went through that pretty quick, 30 minutes. So we have a few minutes for questions, comments. Raj, are you going to kind of let people raise their hand, or how do you want to do this? Or just unmute?
Yes, we can. They can raise their hands, or we can unmute. I believe that Melody posted something in the chat to everyone. If you wanted to just briefly highlight on that.
Oh, I can't see it. I can't see the chat for some reason. What does it say?
Looks like she some commentary or an article.
Oh, okay. Here we go. I can see it now. Okay. Let's see. Okay, Melody from Kratom effects on pain tolerance were assessed in randomized placebo-controlled double-blind study. So that this is a human study, it looks like. During a one-patient inpatient stay, participants received a randomized sequence of kratom and placebo. Pain tolerance was measured. Health status, vital signs, objective and subjective indicators of withdrawal, self-reported data on lifetime kratom use patterns, and assessment of blinding procedures were evaluated. Their conclusion was that kratom demonstrated a substantial and statistically significant increase in pain tolerance. Further rigorous research on kratom pain relieving properties and safety are needed. So that's great, you know, and I don't believe that we should rule out the fact that there are potential benefits to this drug. But I think we should recognize that it is a drug and it does stimulate opioid receptors. So it's no surprise that it helps pain, but it needs to be studied and controlled because of all the things I mentioned. There's huge variation in concentration. There can be a lot of side effects. It is addictive, and we just need to recognize that and be cautious. Oh, my mic is cracking when I move my head around. So any other comments? And I'm happy for people to unmute, and I would really like to hear Dr. Helander's comments about what's going on in Sweden.
I can just briefly mention that mitragynine is scheduled in Sweden, but the plant is not. So that's the problem, because it's a huge import of different plant materials to Sweden from Thailand, for example, and the customs cannot do anything because the plant material, they say it's being used to produce soap or whatever.
So it's a problem in Sweden, you said earlier.
Yeah, according to how much is important, the use is quite substantial, but testing is not very widely used. So I guess it's a lot of under detection of how many people are actually using Kratom or mitragynine.
Okay, thanks. So Melody posted another chat. Do you want to unmute and mention your thoughts, Melody? Anyway, there's another post in the chat from the website from NIDA. And I do know that NIDA has not ruled out, and I think that's appropriate, that there may be benefits from this drug. So it needs to be studied. I'm just reading what she put on there. But anyway, and it could be useful in treatment of opiate use disorder, you know, as an alternative or in withdrawal management. Other comments? Has anybody else seen a problem in health professionals? Feel free to unmute if you.
Looks like Doug Lewis has something he would like to say.
Oh, good, Doug.
Sorry, it took me a second to unmute. Yeah, what we're starting to see, since we're looking at.
Tell people who you are, Doug.
I'm Doug Lewis. I'm with United States Drug Testing Laboratories, and I guess I'm the chief scientific officer now and the president. But we've been looking at metragedine and 7-hydroxymetragedine in here for about a year now. And we are finding metragedine. It's relatively low prevalence, but we're finding it. What's interesting is that 7-hydroxy is at very low concentrations in here. Even when we find metragedine, that's pretty obvious.
Interesting.
What we're probably going to need to do is make a decision. Do we really want to pursue 7-hydroxy? If we go that route, we're going to have to think of it in the same kinds of terms that you pursue carboxy THC in a hair sample. You're measuring it in femtograms, not in picograms. So it's doable. It's the value. What's the value? If we find metragedine, your patients are obviously experiencing 7-hydroxy. It's just not a very stable compound, but you can infer that it's going to be there if we find metragedine in here. Something that we're finding it more commonly though, Greg, we're finding it in the umbilical cord of newborns.
Wow.
And these are, what's scary is we are finding it as the only opioid, and they're going through neonatal abstinence syndrome. And
wow.
That concerns me more. That's a bigger part of my concerns, is that in these kids who didn't take it on purpose, they're kind of stuck.
Right.
They are experiencing a neonatal abstinence syndrome that looks very much like any other opioid. And
I'm really wondering why pregnant women would take it. I mean, is there?
It's available.
Yeah.
If they can't get anything else, that's what they use. They use.
Well, they may be being told it's herbal and safe.
Yeah, I know. So you know the story as well as I do. That if you hear it often enough, you start to believe it, and you can convince yourself.
Yeah.
And if it allays symptoms, we all know that it's affecting the mu receptors.
Yeah.
So that's the game.
So back pain of pregnancy or whatever,
whatever you're going through, or if you can't do what you want,
that's fascinating. And I've looked through the literature and I haven't seen that mentioned, Doug. So that really needs to be reported.
Yeah, we just got a paper. We presented. We had a poster, but we have another one at the Midwest Association of Toxicologists.
Great.
Next month.
Great.
So it's just getting out there, and we have a couple of colleagues that are going to be pursuing this, especially in West Virginia, where it's a little more common than any place else. And maybe offline we can talk a little bit about it.
Okay.
I don't want to bore everybody with the details.
Super. Any other comments or questions? We've got world-renowned people here on this webinar that could answer questions. Dr. Helander in Sweden has published a lot about ETG and phosphatidylethanol, and a lot of very quality research on drug testing.
I have a brief comment.
Good.
Merrill Harrington, former alcoholic addict. I was invited by John to attend this. I just absolutely find it fascinating. And I just wanted to actually extend my praise and congratulations to the people on the front line here fighting this. It's a little like tilting at windmills, as near as I can tell, at least from my history with drugs and alcohol. It's as long as it's all about the money, gentlemen, at least as near as I've been able to tell. It's all about the money. And as long as they're making tons and tons of money, and we know they are, I think you're going to still have this problem. And the addiction is like any other addiction, is I want to feel better right now, today. And I get that. I totally get it. But my congratulations and praise to each and every one of you for all the work you're doing. It's just incredible. And I'm just going to sit and listen for the rest of this. It's been very enjoyable. Thank you so much, Doctor.
Thank you, Merrill. Yeah. Any other, we welcome any other comments or questions.
I have a question. I'm Paul Steyer from Oregon,
Yes.
addiction medicine, family medicine, and I also serve on the California Osteopathic Medical Board's diversion committee and have done that for 17 years. So I'd be interested in hearing people's experience in treating people both in the acute withdrawal stage, and because there aren't any real protocols per se, it's been pretty much anecdotal, and also then thereafter in terms of relapse prevention. There's no question that it has, it becomes another of the substances in the substance use disorder constellation. Cross addiction happens. It's used as an opioid substitute, not it. It may or may not have therapeutic benefit some time down the road once its physiology, its pharmacology, and it is better understood, and we have real ways of dealing with it. But the way it's being used now is recreationally, and so I'd be interested in hearing other people's comments in their patient experiences and what they're doing to get people withdrawn.
Yeah, Scott, I see you posted a note on the chat that what do you tell a patient who's trying to get off heroin by using Kratom because it helps withdrawal? Anybody want to take a shot at answering that? What do you tell them, Scott?
Well, I tell them the same thing that I would say for any street substance, basically in helping to assuage their symptoms, that you don't really know what you're getting, and it's better to do something that's got better metrics.
Yeah, exactly.
Yeah, this is Dr. Katie McQueen from the Texas Physician Health Program here.
Oh, hey, Katie.
Yeah. In my other job at La Hacienda, we've treated a number of people with primary Kratom use disorders and then Kratom in combination with other substances. And it appears to respond to buprenorphine in terms of its use for detoxification and ameliorating the withdrawal symptoms. The concerning thing is that it actually has a lot of dysphoria that goes along with the withdrawal, and many patients, in my experience, I've heard that it has some dissociative properties, and in withdrawal, it looks very much like withdrawal from dissociatives like PCP or ketamine. So a lot of dysphoria, responds to buprenorphine, definitely has addictive properties independently and in combination with other substances. And unfortunately, all of that's clinical experience. Nothing.
That's very helpful. Thanks, Katie. Very interesting. You've encountered that directly. I've not actually treated any primary Kratom addictions, but we have detected it, like the case I presented, in health professionals, most of whom were trying to use it to get off opioids.
I don't know how many of our health professionals are using it yet, but
yeah, you're probably not testing for it like most people,
More to be revealed.
Yeah, exactly. You're not going to see it if you don't test for it. And I don't know what it costs. Doug, do you know what it costs to add Kratom hair or Kratom urine? It might vary a lot depending on.
As an add-on in the hair candles, I think it's ballpark. I think it's a $40 add-on.
Okay. So that's not too bad. Great.
Yeah, I don't think so.
So any other comments or questions, and we'll wrap this up in a few minutes.
Greg, I've got one. I don't know how good of a question it is, but when people are using Kratom, is there any way of knowing how much of the psychoactive agent they're actually receiving in the form that they're taking? And is there a way to figure out what has actually what has actually been metabolized in the drug screens. I see that people can buy Kratom anywhere, but how could we know
Right.
how much they're actually taking in their system to have the effect that they want? Seems like a big question mark to me.
That is a big question mark. There have been studies where they looked at blood levels, and they vary quite widely, as do the concentrations of the active ingredients vary, as I mentioned. So I don't think we know. I mean, I would imagine that the quantitative hair and urine levels aren't exacting, but may, have some, indicator of how much a person's been taking. But I just don't think that's been carefully. I've not seen any reports that really mention that. That's a good point, John. Anybody else? Does anybody currently on the line, feel that Kratom is not an addictive drug? I did see that Melody posted, and I know that Melody can't do the audio right now, but she posted a quote that Kratom has low potential for abuse. That may well be, that was said about tramadol too, that it was a non-opioid, non-addictive drug. And then we started seeing a lot of cases. So I think we're, in the clinical setting, seeing Kratom abuse and dependence and side effects and DUIs and so forth, not huge numbers. So it's relatively safer, but certainly not totally safe. And there's a lack of control over the concentration of it in the herbal source. So that's a confounding issue that I think is the case with a lot of herbal preparations. So anyway, what I'm advocating is to prohibit it. I don't, at this point, in people that have had problems with addiction that are in monitoring, such as our health professionals, and put it in their contract as a prohibited substance, because if you don't, they're going to say, well, it's legal in my state or whatever, and you run into that. So you should include it in the contract and test for it. That way you'll know who's using it. Again, any other final comments or questions?
Greg, it looks like Brad Fitzwater had a comment, and Aaron M has a question about the testing being reliable.
Okay, so yeah, Brad chatted, buprenorphine would be a better choice for detox.
Yep.
That it's a proven drug that works, and there are economical sources for that now, as there are more generics or brand names coming out. So yeah, it's more reliable. And any comment about that?
Yeah, go ahead.
Yeah, the question about is it reliable? We pick up mitragynine really well. It's the 7-hydroxymitragynine. Because it's an unstable compound, it just degrades very rapidly. We thought it would stabilize in the hair matrix. It doesn't appear that that's the case. It appears that it does degrade. Your hair is exposed to the environment, and we're getting 3 months of history, but that's 3 months of degradation too. So apparently, if we want to try to have a better look back, we're going to have to push the sensitivity by about a factor of 50 to get numbers where we might be able to get an estimate. But what are we measuring? We're measuring how much degradation has occurred relative to the mitragynine, and I have no idea how everybody's liver functions and how much 7-hydroxymitragynine you actually were exposed to. So right now, I don't think you can rely upon the amount of 7-hydroxymitragynine in someone's hair to estimate how much you really got exposed. And that's the opioid that your patients are craving.
Right.
The mitragynine is not doing much of anything, in my opinion.
Yeah.
But
right.
the 7-hydroxy, that's the stuff
active. It's an active metabolite. Yeah.
Absolutely.
So thanks, Doug. I think detecting mitragynine is enough. You know, kind of like what we do with cocaine. We look for a metabolite, in that case, not the parent drug, but finding the parent drug, you know, tells us somebody's been using Kratom. So that if in our field of substance use professionals, you know, that's probably enough. So I don't think, you know, unless there's some new data coming out that says it's valuable, I don't know that we need to get the 7-hydroxy levels. Annette from New York. I think you're still in New York.
Yes, I am. I'm still here. Hi, Dr. Skipper.
Hi. Thanks for joining us.
Good to talk. Yeah, it's good to talk to you. I can tell you that I have one physician who's currently suspended where Kratom was the substance of abuse. And I, interestingly, was on a call with another laboratory besides United States Drug Testing Laboratory. And we were talking about actually CBD. And I asked the toxicologist about Kratom testing. And he said in his experience in the general public, he has seen a decrease in interest and use, but in testing of pain management patients, about 1 to 2% of the samples out of the pain management clinics are positive for Kratom.
Wow. So it's fairly common, actually. Thanks for that input. So Melody posted another comment about the HHS, Health and Human Services, withdrawing its request for a ban on Kratom, saying that there's a relative lack of evidence that Kratom can be abused. Yeah, so this is the dilemma we get in with all these new opioids. They all seem to come out looking good at first, and then as time goes by, we find, you know, people abusing them and taking them in higher amounts, or, you know, having problems. So my belief is that any drug that stimulates the mu-opioid receptor has the potential for addiction and abuse at some dose, some level, in some way. And so we need to be real careful about it. And I think Kratom is interesting, but it seems to me, like I said, that we should prohibit it in people that are in recovery from addiction, particularly those in safety sensitive roles, you know, pilots, doctors, et cetera, because it does have some mood altering effect, and there's a lot of concerns about using it for the reasons we've talked about. Any final comments, and we'll shut this down. Well, thanks everybody for coming on board with us with this webinar. We're going to keep doing webinars, I think.
Greg?
Yeah, Tom.
Hi, Greg. It's Tom Speck. Just a quick question. I don't know if I missed it. How did you handle it with that anesthesiologist who came back from a leave of absence and tested positive, you know, given his explanation that it's legal and so forth? Yeah,
well, we actually, as I recall, it's been a couple of years, but as I recall, we considered it sort of some degree of a relapse, but because he was honest and truthful about it, I don't think we did advise his monitoring program to continue testing for Kratom, but I think he actually did well. And, you know, it turned out to be a positive thing in a way, as relapse often can be, because it helps people see how crazy it is. You know, for him to be home on a pass, an anesthesiologist addicted to fentanyl and taking his Kratom, pretty nuts, you know, and I think he faced that and it helped him. So I think it turned out positive.
Great, thanks, Greg.
You're welcome. So Raj, you want to finish this with the comment you made?
Sure. Again, thank you folks for joining and supporting Dr. Skipper. And we've had a couple of requests from some participants. If we could share your contact information or make it available. Some folks would like to contact some of you guys and I guess have further discussion in regards to this topic. So if that would be okay, if you could maybe just shoot Dr. Skipper an email. And what we'll do is we'll include this on our thank you follow-up email that will include a recording of this webinar. And so if you could just possibly reply back to us that it would be okay or not okay to share your information upon request, we would appreciate it. Thank you.
Thanks, everybody. Appreciate it.
Thank you.
Thank you, Greg.
Thanks, Greg.
You're
Great
welcome.
webinar.
Hey, Michael.